everybody, welcome to week 2. This week, societal factors affecting nursing patient education and curriculum. Interesting topic. I'm really looking forward to seeing what factors you choose to include in your DQs and then in your papers. During the day, I am a full-time school district nurse working with special education students that have acute and chronic health problems. So one thing that's really impacting my role is the increasing complexity of students' healthcare needs in the schools. We have so many students with asthma, diabetes, seizure disorders. I have quite a few students with tracheostomies. I have a couple students who are on ventilators. So that is definitely a trend. Trying to get more students into local school environments to enhance their education. For me, the education portion is really working with people to try to create a safe environment for these students, and then working with the classroom teacher and staff about how to take care of these students. My ventilator students and trach students, I do have a nurse with them during the day, but students who have feeding tubes, students that need catheterization, students that need inhaler treatments, things like that. Those are things that I am teaching to the staff. So societal trends, I think, have really affected a lot of what I do as far as educating. All right. Several readings this week, and I think they're pretty interesting. They cover kind of a broad area of topics. If you look at the objectives this week in our syllabus, one of them is really, really broad. So that's why there's kind of a mixture. One of them I really liked had to do with keeping nursing in the nurse practitioner role. I think we have a lot of excellent nurse practitioners. I think, unfortunately, some of them have been kind of sucked into the mini doctor role due to economic circumstances, having to see so many patients within a certain period of time, things like that. The best practitioners I know definitely still keep nursing in their role. They practice a very holistic method of providing health care, really looking at all the circumstances surrounding a patient, why they're in the shape they are at that time. And then one thing in the article, it talked about healing begins with listening. And I think nurses are especially good at active listening to their patients and really trying to figure out what's going on with them. So I really liked that one. There's another interesting one about BSN prepared nurses versus ADN or diploma nurses. Hospitals seem to prefer BSN nurses, prepared nurses. Some hospitals have strict requirements about them. Others, it's just a preference. I know nurses that want to work in the VA health system. It's a requirement. And hospitals and other health facilities, a lot of them are really good about tuition reimbursement. But what about pay differential? And some of them use clinical ladders to reward pay differential. But I'd be interested in your feedback, one, about does your employer require a BSN for entry-level positions? Is there any pay differential for BSN positions? Do you think there should be BSN pay differential for staff positions? It's a really interesting discussion. ADN and BSN prepared nurses take the same NCLEX. They care for patients, the same patient loads. So I'd be interested in your thoughts about that. Just go ahead and respond to this thread. And I'd like to hear about that. Some of the other articles have a little bit of a common theme about including ways that active learning strategies are used in the classroom to enhance understanding. Active learning strategies, we're talking about things that aren't lecture. So we're talking about things like sharing stories of your past experience during open dialoguing in class, role-playing, gaming, using an unfolding case study that follows a patient scenario and students have to determine care for that patient. Oh my gosh, there's so many active learning strategies. One of the things with using active learning strategies is making the transition from traditional teaching, which is all kind of lecture, PowerPoint, I'm imparting my knowledge to you, to being more of the guide, the facilitator, students being an active part in that learning, students helping to guide the learning. And there was actually some research done that when a lot of educators start out, they will teach the same way that they were taught as a student. And I don't know about many of you, but in my first nursing education in a diploma program, it was definitely lecture. And so making the transition to that, and I think a lot of faculty have a hard time understanding that using active learning strategies are teaching they are teaching content. They're not just an add-on to teaching content. And as you progress more in this program, you'll be hearing much more about active learning strategies and how they can be incorporated in teaching and enhance retention of knowledge and that sort of thing. So we'll be talking more about those. All right. Oh, there was one article, I can't remember which one. Oh, it was the lecture for this week that talks about the history of nursing education. I myself was a diploma grad initially, and I was actually the last class at my nursing school where we still wore caps at the start of our program. And then we started bringing in men into the program, and well, if the guys didn't have to wear caps, the girls didn't have to wear caps. So they went away. But I remember my pinning ceremony, and some schools in nursing still have pinning ceremonies that can actually be quite nice. But anyway, it was interesting looking at the lecture for this week and kind of thinking back on how far we've come in nursing education. All right, so this week we just have one discussion question, but remember, you still need to have those 3 substantive responses to your other students' posts. And we've got the paper due this week. Again, please let me know if you have any questions as you're finishing that project up. I try to get my papers graded within about 5 days of when they're submitted. I have 7 days. I try to do it within 5. Sometimes I can do it sooner. These papers aren't super long, but I don't have a feel yet of where you are at with your writing skills. So I don't know how much editing I'm going to have to be done. But I will get them back to you as soon as possible. All right, that's it for this week. I can't wait to read your posts, and I'll see you in the main forum.